Good morning, dear students. Welcome to Punjab State Open University. Today, we are going to discuss further the semester 2 of Sociology module of BA Liberal Art program. This was the syllabus. In the last video lecture, we talked about the religious components, composition of Indian society. In today's lecture, we are going to look at the population growth in India since independence. Population growth in India since Indian independence is the topic for today's video lecture. As all of you know that the population of India has grown like leaps and bounds. India is the more highly populated nation, and it has also crossed China, and today it is the today Indian population is the first in terms of numbers. India stands at the top. It is the largest population of any nation in the world is in India. So this has been a historical journey, and let us trace this historical trajectory, that how the Indian population has grown, and then we'll get into the pros and cons, means what are the benefits, what are the problems that comes with high population, why it is growing, the reasons of its growth, the kind of pressures that it puts on the economy, the sustainability, the environment. So these are all the issues that are again connected to India's population growth. Since India's independence, the population in India has seen the growth trend has been very upward, and with this growth trend there has been a lot of disturbances, or this is a cause of concern for not just the policymakers but for environmentalists, for general public, that how India is going to cope up with this kind of population, how it is going to meet the needs of this large expanse of people. So let us look into this, that during the colonial period, India's population experienced various trends and changes. Before Indian independence, when Britishers came to India in 1775, that was in 18th century to 20th century probably, when the British colonial rule was there. At that time, the population was not very high, and there were like patterns. The overall growth was very slow. The life expectancy was low, and also there were a lot of natural disasters that were coming. India's population experienced various trends and changes influenced by patterns such as, again, because Britishers came, they introduced so many new things that the growth patterns were improved, and this also led to a growth in the population. Like factors like colonization, economic policies, societal transformations. Before British colonization, India had a very stable population with fluctuations due to natural events like famines, diseases, and wars. Overall growth was slow. Initial period, India's population growth during early phase of British rule remained relatively stagnant or experienced slow growth. Some regions faced famines, wars, and diseases, which also limited the growth of population. In the mid of the 19th century onward, with the British East India Company's rule and later direct British control, India's population began to grow more steadily, improved healthcare, reduced mortality rates because of introduction of Western medicine, and increased food production through modern agriculture techniques. These are the factors that contributed to India's population growth. Again, Britishers introduced railways, which facilitated transportation, trade, contributing to urbanization, population growth on cities, which were connected by rail networks. Because of the British economic policies, British colonial policies such as land revenue system and agricultural practices, it again had a very mixed effect on India's population growth. While some policies led to agricultural developments and increased food productions, others resulted in land dispossession, impoverishment of farmers, and famines. British also, they were employing the modern healthcare system, intense sanitation measures, then vaccination programs, establishing the hospitals. These are all factors that contributed to reduced mortality rates, and then they also contribute to the population growth. The British also facilitated migration within India and overseas, which had demographic impact on both sending and receiving regions. India also experienced several devastating famines during the colonial period, including the Great Bengal Famine in 1717, the famine of 1896-97, and Bengal Famine of 1943. These famines, exacerbated by British policies and administrative failures, resulted in millions of deaths and population decline in affected regions. Overall, India's population during the colonial period saw both periods of slow growth and more rapid expansion, influenced by a complex interplay of socio-economic, political, and environmental factors shaped by British colonial policies and interventions. However, India's population growth since independence, that is in 1947, has been significant. At the time of independence, India's population was around 350 million people. Of course, we can see that the growth after Indian independence has been very upward. Since then, the population has grown rapidly because of high fertility rate, improved health care, and advancements in agriculture, leading to increased food production. In the decades following independence, India implemented various family planning programs to control. Of course, I told you that this was a cause of concern, so, and number of family planning programs were included in the policy frameworks, including the family planning, two children's law. However, these efforts had limited success and initially due to challenges in reaching remote areas, cultural factors, and lack of access to contraceptives. Despite these challenges, there have been some success in slowing down the population growth rate over the years. According to data from United Nations, India population growth rate peaked in 1970s and has been gradually declining. However, due to large population base, even a modest growth rate, since because the population itself is very higher level, so they will be reproducing at the same level. Even a small percentage of change translates into significant absolute numbers. As of early 2020s, India remains the second most populous country in the world with a population exceeding 1.3 billion people. And we know that today it is the highest populous country in the world. The rate of population growth has continued to decrease, but India still faces challenges related to overpopulation, including pressure on resources, infrastructure, and environment. Ongoing efforts focus on the efforts are going on, and they mostly focus on promoting awareness, education, healthcare, and family planning to achieve sustainable population growth. India's population growth after independence can be attributed to various factors. Decline in mortality. The death rate has come down. Infant mortality rate has come down. Improved healthcare infrastructures, advancements in medical technology, better access to healthcare services has led to significant decline in mortality rates. Vaccination programs, disease control measures, improvements in sanitation and hygiene has also played a crucial role in reducing the infant mortality and increasing life expectancy. High birth rate. Despite there have been efforts to promote family planning, birth rates remain relatively high, especially in rural areas and among socioeconomically disadvantaged sections. Cultural and religious factors, as well as limited access to contraceptives and family planning services, has also contributed to high fertility rate. Social norms and practices. In case of India, traditional norms favoring large families, particularly in rural areas, continue to influence reproductive behavior. Factors such as desire for male heirs, lack of awareness about family planning methods, and societal expectations regarding fertility contribute to sustained high birth rates. So, limited success of family planning programs. While India has implemented various family planning initiatives since the 1950s, including the National Family Planning Program launched in 1952, the success of these programs is varied. Challenges such as inadequate infrastructure, limited availability of contraceptives, poor quality of services, and cultural barriers hindered effective implementations and uptake of family planning methods. Population momentum. Even as fertility rates started to decline, India's large population base ensured continued population growth due to population momentum. This momentum occurs because of high proportion of young people in the population who are entering the reproductive age, even if the birth rates decline. So what we are trying to tell is that even if the birth rate decline, but since there's already large number of young population, and these young population is now getting into the reproductive age, although the birth rates may decline, but the population will tend to rise at the same levels. Improvements in socio-economic conditions, economic development, improvements in living standards, including better access to education, employment opportunities, often lead to an increase in population growth, and families feel more secure and confident about their children's future. Urbanization, migration from rural to urban areas, that has also contributed to population growth. Urbanization eventually may lead to low fertility rate. Initially, it contributed to increased population growth as people moved to cities in search of better opportunities. Overall, the combination of declining mortality rate, high birth rate, cultural norms, socioeconomic factors, these are all factors that have contributed to India's population after independence. Despite their efforts to promote family planning and control population growth, India's population has continued to rise. So this is because of these reasons that today India is the most populous nation in the world. And since then, the India's population growth since independence has shown an upward trend. And in the following video lectures, we will be going to discuss the pros and cons of this population growth and what can be done to control it. With this, we have come to an end to this video lecture, and I'm sure that you're going to have a good, happy learning experience with all of us at Jagat Guru Nanak Dev Punjab State Open University, Patiala. Thank you so much for watching this video.